Let's talk about the concept of ovarian reserve, which is really confusing and also really stressful for a lot of patients. First, I have to explain normal ovarian physiology before I can explain ovarian reserve. Every month, a small group of eggs wakes up from sleeping, and we can actually see those eggs on ultrasound. Then what happens is your brain and your ovaries talk to each other, and one egg is randomly chosen to grow and ovulate. The rest of the eggs die. So every month you have a group of eggs, wake up, die, with only one egg growing and maturing and giving you a chance to get pregnant. Now, if you don't have any fertility problems and you just get pregnant with your one egg that ovulates, the number of eggs in that ovarian reserve actually doesn't matter at all. But the ovarian reserve, which is that number of eggs that are also resting in the ovaries that month, like the military, the reserves, those come into play if we need to do something to try to treat infertility, or if you're trying to manipulate your ovaries, like for egg freezing or other fertility preservation, because the more eggs, the better statistical chance that we have of having a successful treatment. And so it's really important to remember that a diagnosis of diminished ovarian reserve is actually not a medical diagnosis or even a reason. It's absolutely not a reason for infertility. And if you get that diagnosis, it also doesn't mean that your infertility is untreatable, intractable, hopeless. Absolutely not. It just means that we have to take into account your particular ovarian follicle number or reserve when we're devising your treatment plan to get you the best outcomes, to help you plan your treatment, and to help you manage your expectations.